Good evening and welcome to today's webinar. I'd like to welcome you all to the webinar. We'll start promptly at 7:10. For now, you maybe can type on the chat box and let us know which PSK branch you're joining us from, and for the students, which school you're joining us from. Thank you. Hi, everyone. Welcome to today's webinar. I'll be the moderator for today's session. My name is Dr. Wangeshi. I am a member of PSK, and I'm thrilled to be hosting this event for today. So our topic and theme for this year's World Pharmacy Day is Pharmacists Strengthening Health Systems. Our panelists for today and our speakers for today are Dr. Louis Machogu, he's the president of PSK, Dr. Daniela, who is the vice president governance in PSK, Dr. Tabitha Kimani, who is the vice president advocacy and lobbying in PSK, and Dr. Patricia Nyokabi, who is a member of the PSK. So without taking too much time, I would like to go through some ground rules and then we can start our session. So thank you all for participating in the session. All participants are muted during the entire course of the session. Kindly, if you have any questions, type them on the Q&A tab, and the panelists or the speakers will address them after the presentation. For PSK members, if not already done so, please subscribe to the PPB portal for the conference so that you can get your CPD points, and they will only be awarded to paid up members. The session is being recorded and will be available on PSK's YouTube page. For those who will be subscribing on the PPB portal, the search keyword is strengthening health so that you can be able to get your CPD points. The agenda for today, we have the opening remarks being done by me. Our panelists are Dr. Louis F. Machogu, Dr. Daniela Munene, Dr. Patricia Nyukabi, Dr. Tabitha Kimani, and then we'll have a Q&A session and closing remarks at the end of the session. This is the theme for this year, Pharmacy Strengthening Health System for World Pharmacy Day, which will be on the 25th of September. And pharmacists are very integral to the world's functioning health system, as the COVID-19 pandemic highlighted. So we also have our Pharm Exchange newsletter, and there's a call for articles out right now. So if you have any articles that you would like to share, these are the guidelines, and the deadline is on 28th September. You can also advertise your business on the Pharm Exchange. Yeah, so I think I would like to start us off by welcoming you all to the session, and our first speaker is going to be Dr. Daniela. So kindly, Dr. Daniela, if you'd like, the session is now yours.
Thank you so much for having me on this webinar. And I'm really excited that the theme of this year's World Pharmacists Day is about pharmacists strengthening health systems. Because it's so important for us to think of ourselves as a part of the health system that has so many moving parts, and familiarizing ourselves with all those other parts and what value we can add. And so, colleagues and fellow distinguished panelists this evening, I'd like to challenge us to think as follows. So first, identify your unique interest and strength as a pharmacist. Are you more clinically oriented, or are you more non-clinically oriented? Of course, I don't need to get into explaining the clinical expertise of a pharmacist where it's needed. We can specialize and sub-specialize as pharmacotherapists and many other specialized fields, oncology pharmacists, pain pharmacists. And I think that is the forte of my colleagues in clinical practice. However, I want to bring to your attention non-clinical areas. I think there's such a broad scope for pharmacists to practice in non-clinical areas. The obvious ones come to mind are the supply chain ones, because many of us have supply chain experience just from our early years. But it doesn't end at supply chain. There's management consulting of health systems strengthening. There is policy advocacy. We have colleagues like Dr. Frank Wafula. He's a policy specialist in health. And when you get to that point of practicing as a healthcare management consultant or a policy expert in health systems, or even a digital health expert, it's less and less important that you're a pharmacist, but you find that your pharmacy training gives you a very big advantage in understanding the health system. Now, one of the things I'm going to point out is our unique training as pharmacists gives us a broad view right from the get-go compared to other healthcare professionals that are focused on the patient in front of them. Because of our exposure to managing supply chains, and your mindset is that medicines are manufactured in a factory, and the supply chain has to be qualified all the way till the drug reaches the patient, and several quality assurance measures have to be in place. Patient safety has to be looked at, the pharmacovigilance and monitoring after the patient takes the medicine. We tend to have a very broad view just from our undergraduate training of the moving parts of a system and how to keep them moving optimally. Now, compare this to somebody who is trained just to take care of the one patient in front of them and their pain in their arm and that narrow scope. So in terms of health system strengthening and having what I call sometimes an enterprise approach, looking at the different moving parts of the health system and the pillars and what needs to be strengthened. To get into that field, our pharmacy training prepares us very well to think broadly. So you're able to see the efficiencies that need to be introduced, not necessarily through pharmaceutical interventions, but even from other interventions. So we should not restrict ourselves just to the pharmacy side. And I'll give a disclaimer. I always tell people I'm a generalist. So I work in health system strengthening. Sometimes my input is to do with pharmaceuticals, but sometimes my input is not to do with pharmaceuticals, but I have a pretty good idea of what I do because I see the health system from a bird's eye view, and my pharmacy training helped me to do that. So my challenge to you colleagues is let us not be narrow-minded. Let us think broadly. And if you choose to specialize in clinical fields, then specialize and narrow down on a very specific field where there's less competition and less practitioners, so you can expand your space and be an authority in that field. I'll give it back to you, moderator, and I'm also really keen to hear from my colleagues, Dr. Machogu, Dr. Tabitha, and Patricia.
Thank you, Doc, for that insightful session. If you have any questions that you would love to pose to Dr. Daniela, kindly put them on the Q&A chat box. I'd like to give the floor to Dr. Patricia to share her presentation.
Thank you very much, Sheila, for that introduction. I think based on the audience today, the pharmacy students, you asked me to share my journey, so I'll be delighted to do that. So good evening, esteemed members of the profession and our distinguished guests for this particular forum, the pharmacy students in various universities across our country. I'm feeling so much pressure today because I've been put on the panel together with presidents and vice presidents, but thank you to the PSK leadership for finding me worthy of being part of this panel. So I'll start with an introduction. Dr. Patricia Nyokabi, Senior Pharmacist, Kenyatta National Hospital, Othaya. I'm currently serving as a pharmacist in charge of supplies. And so I'll go ahead and share how I got here. So I was in the pioneer class of JQuat Pharmacy. I've seen so many JQuat Pharmacy students in the comments. Yeah, so I was in the pioneer class. I joined in 2011 and I finished in 2016. So by virtue of me being in the pioneer class, a few of my classmates and I got together and decided to start the JQuat Pharmacy Students Association. And I was elected to be the founding chairperson. And so right now the association is is in its 10th year. Such great progress. I keep seeing them posting in their webs. So being the founding chairperson, I was tasked with, like coming up with the constitution, coming up with the calendar of events. Of course, that has changed a bit till now. And so during my tenure, then I was exposed to the work of the International Pharmaceutical Students Federation, which is to FIP what KEFSA is to PSK. It's a international student body of pharmacy students. And so I served, then after having served in JPSA, then the following year I served as a contact person for Kenya Pharmacy Students Association. And I was so passionate about it. I served so diligently. I remember that year, the pharmaceutical symposium was in Rwanda. I brought together around 30 students from various universities in Kenya, and they went to Rwanda for the conference. And based on that effort and many other efforts around the year, then I was awarded the IPSF Contact Person of the Year during a conference that was held in India. And so it's during that time that I was really getting into the groove of, like Pharmacy Students Association. And it was, how stressful pharmacy school is. So this was the breather for me, like something to always look forward to, so that I'm not always in the library studying and stuff like that. So I bid for us to host the African Pharmaceutical Students Symposium. And so this happened in Mombasa in 2016. It brought together around 130 delegates from 10 countries in Africa. It was a big deal. It was good. We loved it. Even till now, I have my friends from around Africa reaching out to me just in June this year. I helped organize a honeymoon for my friend from Rwanda who really enjoyed the experience in Mombasa and wanted to come back for his honeymoon. So that's the kind of experience I had as a student. That as much as I was studying, I was also doing this on the side, traveling around the world. I think I lost count, but I think I traveled to around 8 countries based on my service to the International Pharmaceutical Students Federation. And so I graduated, I finished in 2016, graduated, I think in December 2016. And so based on the experience that I'd had, my leadership experience, then I applied to YALI. Some of you may be familiar with YALI. It's sponsored by USAID. It was signed by President Barack Obama. And so I joined in towards the end of 2016. I was in cohort 13 for just in case there are other alumni in the room. And so I joined. It was a great leadership experience, great exposure. I apologize if you can hear some music in the background. I'm in the village. I'm in Othaya. Yeah. So after that, I started my internship. I was posted after, of course, sitting for stage 1 and stage 2 exams. I was posted for internship in. So I did hospital pharmacy in Muranga for 6 months, and then Universal for the industry part, and then pharmacy in Westlands for the retail pharmacy, community pharmacy, yes. And then I finished internship in 2018, I think. And I got the shocker of my life because we're in the first group to not be posted after internship. Those who are older know that internship was almost, being posted after internship was almost automatic. So here we were not being posted. And so what do? Like we had no other plan for our lives except, like we knew this will come naturally. And so what happened is that I started volunteering. Yeah, I was coming from, like good salary, internship salary, and all of a sudden there's nothing. And so I volunteered at the HCG Cancer Center. It's the MP Shah Oncology Center. I was there for a while, and then I got an opportunity to intern in the Universal Health Coverage Department of the Ministry of Health. That's around the time when former President Uhuru Kenyatta had come up with the Big Four agenda, and universal health coverage was one of them. And so I had an opportunity to volunteer there. It was a small team, 9-member team, and I was one of them. And yeah, so I joined, and like being thrust into the deep waters of policy and health financing. And here we were coming up with a strategy for UHC pilots, and selecting which counties will this be, and how will you go about implementing it in those counties, and like monitoring whatever the counties were doing, capacity building in the counties. And here I was, just an intern, very wide-eyed, going to very high-level meetings with governors, with MCAs and MPs, with officials from the World Bank, from WHO. And it was a great exposure for me. It introduced me to a lot of health financing stuff, and that's why that motivated my interest to master in health economics. So I have completed my master's in health economics and policy. And so around that time, because throughout I was still an intern, no pay, I was just a volunteer. So around that time, then the Othaya National Teaching and Referral Hospital that had been constructed a long time ago, I think during the tenure of President Mwai Kibaki, now it was completed. It was completed a long time ago, but now they wanted to operationalize it. And so they advertised for many opportunities, of course, because they're starting the hospital from scratch. And so I applied and I was taken in as a pharmacist. And so we basically started the hospital from scratch. And it didn't pick as they had anticipated. And so at some point, the ministry made the decision to let it be taken up by Kenyatta National Hospital and to come in and, like be mentors. And so that's why it exists right now as Kenyatta National Hospital. And so I serve there as the pharmacist in charge of supply chain. I liked what Dr. Daniela mentioned about there being very many opportunities for us to practice. So the role for the theme for this year's World Pharmacist Day is Pharmacists Strengthening the Health System. The health system, as WHO defines it has six building blocks: the health services, health workforce, health information, health products, vaccines and technologies, health financing, and lastly, leadership and governance. And really, there's none that is more important than the other. They're all building blocks for the health system. And so the one that I really come in strongly is health products, vaccines, and technologies. And my role as I serve in the hospital is in this capacity is, like right from selection of medicines to ensure that, like, are they based on our formulary? What are the formulations that we are taking into place? What are the drugs? Because the drugs are so many, we can't have everything, right? And so what's the quality of the ones that we have? Are they safe? Are they efficacious? And also considering our demographic, because based on where we are, then the kind of drugs that we need to stock are mostly, like antihypertensives, anti-diabetics, and not, like something like malaria. In fact, we usually have, but we've had instances where they end up expiring, So it's for me to know, okay, which medicines do we need to select? Apart from that, calculation of the quantities, forecasting and quantification, so that I don't end up having too few or too many that they end up expiring. And then where my health economics comes in is what's the cost implication of these drugs? Because as you know, it's a government setup. Resources are limited, right? I can't have everything that I want to have. If I spend too much on one commodity, it means I won't have other commodities that are very essential. Case in point, let's say trastuzumab, which costs like 70,000. If I have too many of them, it means then I won't have basic ones like paracetamol IV, metronidazole IV, And so what's the cost implication? Just to balance out my mathematics so that I don't have too many drugs at the beginning of the financial year, and then towards the end of the financial year, I've exhausted my budget. And then warehousing, like fast in, fast out, just the usual principles for warehousing. And then lastly, distribution to the various service points across the hospital. So at any one point, we are not lacking the medicines that we need, whether it's at the oncology pharmacy, the inpatient pharmacy, whether it's in theater, in ICU, so they're not lacking medicines that they need. Of course, this is not easy, especially for a hospital like ours that is in the formative stages. We've only existed for 4 years now, and so we still have some work to do in setting up systems. And so, yeah, that in a nutshell is my story. Thank you very much for this opportunity. Back to you, Sheila.
Thank you, Patricia. That was a very insightful session, and it's nice to see that despite the hurdles in your journey, they have actually led you to where you are and you're currently enjoying the working experience that you currently have. It's also inspiring for, I think, some of us who maybe are participants on the call who just completed their internship. So it's nice to know that despite the hurdles of the journey, it still leads you to exactly where you see yourself and where you want to be. So as apologies from Dr. Louis and from Dr. Tabitha, they'll be joining the session in a bit. As we wait for them, maybe we can start the Q&A session. I had requested the students to share their questions earlier, so I'll probably just share what they have. The first question will go to Patricia. So Patricia, there's a question here. Someone is asking, what is the value of volunteering and interning despite not having pay?
Thank you, Sheila, for that question. I'll really attribute how far I've come in my journey to volunteering. Because as it is, opportunities are not as many as there were back then. Even the existence of so many universities compared to just one many years ago. And so volunteering helps you to, like set yourself apart. And really that has been my story, right from when I was serving in various leadership associations when I was in uni. And then right after uni to volunteering at the Ministry of Health, volunteering at the Cancer Center, it really helps to set you apart, because when others are waiting for paid jobs, you already have so much experience in your CV, like you won't be applying for a job and you have no experience. You already gained so much experience from when you are volunteering. Apart from that, it adds value to you. It's in the West where people take a gap year, I think right after high school, just before they join uni, to discover what really is their purpose and passion. And that is what I gained from my volunteering experience, is that through it all, I came to know, oh, I really enjoy this, or maybe I don't really enjoy this. And so it helped to focus me, even as I was applying for, like the job that I do currently, because my passion is in leadership. And that came out very strongly when I was serving in associations in uni. And it gives me, so much purpose to organize events, to mobilize people together, to, like even seek resources and stuff like that. So it helps you really know what are your passions, what's your purpose, as Dr. Daniela was saying earlier. You don't have to do something that you don't enjoy. There's so many fields where you can practice, but how do you get this experience if you don't, like get a chance to serve in some of these places? If that will come in a way, like through volunteering. Lastly, it connects you with people, and really it's the people that I met when I was, and even I was just telling my story, it's someone I met that got me to the next step and the next step and the next step. Because right now people are many, right? Like even the pharmacists, they're more than the system can absorb. Why should they choose you over someone else? It will only be helpful to you if someone already knew you. And how did they know you? You worked under them, you volunteered under them, something like that. So I will attribute my journey really to my volunteering experience. And really, as much as pay is important, there are some stages in your life where it might not be as important, because clearly you just finished uni, you're used to living, and with a small student's budget, it won't hurt so much to, like continue living in the same way, even as you seek better opportunities. So so I will encourage students, as much as you can, seek opportunities everywhere to volunteer, to serve. It makes people recognize you. And also at the same time, it benefits you in the sense that you get to know, okay, maybe I don't enjoy working in a hospital. Maybe it's non-clinical area that I will prefer, or even vice versa. Maybe policy things are not so interesting to me. Maybe I would want to be right where the patient is. So yeah, encourage members to go ahead and volunteer so they can get opportunities. Yeah, thank you, Sheila.
Thank you for that, Patricia. This next question, I'd like to direct it to you, Dr. Daniela. The students are asking, what exactly are health systems and how can pharmacy students contribute to strengthening health systems?
Okay, thanks, Sheila. Let me take a step back to just continue the points that Patricia has talked about volunteering, and then I come to health systems. So I work as a management consultant for health business in Africa. That's what my organization does. Now, in my organization, if you have health training, it's an advantage. But because our role is to provide strategy advisory for health businesses, it's not a must to be a healthcare professional. It just adds value because the businesses that we advise are in health. They're healthcare providers or they're manufacturers of health products. Now, as a rule, because it's a unique type of work, it needs, just logical thinking and a bit of understanding of health. And it's a high pressure environment. We tend to employ people and promote people in-house. We are very wary of employing somebody, especially one who's straight out of school. So we have an internship program, and it's not a paid internship. I mean, we give probably 20,000 just for bus fare. It's not a salary, so it's not a paid internship. And we have had cases where people have interned, and even before the 3 months internship is over, we absorb them. So as an organization, that has become our recruiting strategy. That we get interns, we observe them as they're doing their internship, and then we absorb them into a job. And so for an organization such as ours, and I believe there are many more, if a pharmacist is not willing to do the unpaid internship and learn what is this management consulting, because it was never taught in school, then you're denying yourself of a future opportunity. And as Patricia said, you're also denying yourself of a chance to see, is this really your thing? Maybe you prefer to be with patients. And so being willing, if at all you're able to, of course, if you really need a job and it's really impossible for 3 months, not to have a job. But if you have some sort of support system and like Patricia said, you can get by on your little student budget that you used to have. Volunteering is the best thing you can do for yourself, to show yourself out there, to stand out from the rest who are refusing to come for the internship, and also for you to choose your career path. So now back to the question on health systems. Health systems means the people, the facilities, the products, the laws, the policies, and the infrastructure that exists to make sure that populations are healthy. Right from promotive healthcare to preventive health, to curative and rehabilitative services. So the entire ecosystem that goes to provide health to populations is called a health system. So I'll just repeat the pillars, the building blocks. There is health information systems. Let me not start with health information systems. There is health products and technologies. There is a service delivery. That's the doctor, the nurse, the physiotherapist who's going to treat you, the pharmacist. Then there's health financing, because somebody has got to pay for it all, both from the supply side and the demand side. The supply side is the supply of the commodities, the supply of equipment, the existence of the hospital, who pays the doctors. And then the demand side, healthcare financing, is paying for the service at the point of service delivery. So healthcare financing is a third one. And then we have the health workforce is a big pillar, because somebody has got to provide the service. And then we also have health information systems tying it all. And so these 6 pillars, or these 6 building blocks, need some expertise, all right? So health workforce development is a specialized field in the hands of universities, but also in the hands of post in-service trainers. For example, PSK, we provide in-service training, we provide CPD points, and we bring to you in-service training. There's also universities that can give you specialization education. So these universities are even regulated by government, the schools of pharmacy, schools of medicine, schools of nursing. So they're still part of the health system because they're developing the workforce. If you think about health products and technologies, Patricia is a supply chain pharmacist. So that is part of a building block of the health system. Nobody will be healthy if we don't have the products to treat their disease or even to screen them as part of preventive care if we don't have those glucometers and blood pressure machines. So supply chain is so important. Health information systems is such an important component because you need information to flow through the system. So when a patient presents at a facility, a record has to be done, whether it's in a register, a handwritten register, or it's a computerized register, or it's a mobile app. That information needs to be put in the system to teach the system who is this person when they come next, so that they recognize them. What medicines did they get that last time? What's their medical history? If they find a new health worker, I don't think I need to preach on the importance of health information systems. Now, service delivery, people need services that are accessible. So if you need to manage your blood sugar, but you cannot find a place that can measure your blood sugar for 50 kilometers, then it means the health system is failing you as a Kenyan or as a citizen of any other country. So the health services need to be available. Either you go to the facility or the facility comes to you. They also need to be affordable, and they need to be provided in an equitable way. Everybody has a right to access the services that they need and to choose the services that they prefer. And so, and then in terms of healthcare financing, we have NHIF that pays demand side. We have private health insurances. A big proportion of demand side financing is out of pocket. People who are not on NHIF and they're not on private insurance. But there's also the supply side financing. So if you want to build a hospital and you want to go to the bank and ask for a loan, and the bank does not understand health business, and you're not able to get that loan, you're not able to get investors, then you're not able to bring services to the people where you wanted to build your hospital. So we have to look at financing from that side as well. If you want to set up a manufacturing plant to make IV infusions, somebody's got to pay for that. There's got to be a business case. So if we don't look at easing access to financing on that side, then health services will not reach downstream to the health seekers. And so that's what building blocks of health systems are. They're not abstract, they're real. They're the real moving parts of a system that brings health to you. And from my own experience, because I started off, I did my internship as everybody does, and I realized I don't fit in a community pharmacy, I don't fit in the hospital, I don't fit in manufacturing. And so I found a home in distribution. So supply chain management, regulatory affairs, quality assurance. And then from there, I went into policy advocacy when I was the CEO of Pharmaceutical Society of Kenya. I joined Kenya Healthcare Federation, where I still am a board member, and we do policy advocacy so that there's an enabling environment for health business for private sector to provide health services in Kenya. And I hold many other positions. And so I don't remember the last time I even recommended any medicine to somebody. I'm not clinically oriented. I'm not patient facing. So I always work on the other parts of healthcare that are not direct service delivery. I have got some training in digital health. And so I speak on digital health. I do advocacy around digitizing health systems. And I have my BFA. That is what gave me a foot in the door to all these other areas of contributing to health systems, not direct patient service delivery. And I'm doing my master's in international public health. You know, I think it's useful. But even before I did my master's, I went into all these other fields, and I rise in my organizations because you just need to have a little bit of common sense, a little bit of above average, which we all do as pharmacists, intelligence, and an understanding of like a bird's eye view. If all you think about is maybe my salary or the one patient in front of you, you will not have that bird's eye view, and you'll be no good to the system. So I'd encourage us to have system thinking, because at those levels, there are not many people, and the people who are there, they're not all healthcare professionals. So the healthcare professionals have an advantage. So Sheila, I know I've spoken a lot, but I hope the audience has picked one or two nuggets about what a health system is and how pharmacists can contribute. Already, just by your training as a pharmacist, you'll be contributing to the health system. Naturally, you'll be a service provider. You'll provide pharmaceutical services. But if you wish to move out of service delivery, you can contribute to all the other 5 blocks. Back to you, moderator.
Thank you, Dr. Daniela. That was very, very insightful. And clearly there are a lot of spaces that we as pharmacists can plug into that are not clinically oriented. So the next question is, what challenges have you experienced in materializing an ideal setting of pharmacy strengthening health systems? I think this is a question for both of you. So I'd like to start with Dr. Patricia.
Thank you, Sheila. Oh, there have been so many challenges, and I think I experience most of them because I work in a government setting. As you'll understand, within government, there's a lot of, bureaucracy. They call it red tape. That before something is implemented, it has to go through this office and this office and this office, and I will tie it to that question I've seen. Okay, he chose to write it as an anonymous in the Q&A tab, that he had gone to a primary healthcare service, and the major challenge they had was shortage of medicine. That the medicines come after so long, and they don't even last for a long time. It's a challenge that we experience every day, because I think as opposed to private sector where you can order medicine today and in the next hour or so you have it, within government there are procurement laws that need to be followed, and of course they've been put in place to protect the way that system is supposed to work. And so, tendering process, quotation process, and you can't get drugs just like that, and so then if you have to follow that process, then it takes weeks or even months. And so consistency of supplies is not very predictable, or it's not assured. And so at the end of the day, you get frustrated, right? Because you're suffering, your patients are suffering, and yet it's a law and it has to be followed. So I think that's the major challenge that I experienced in my current setting. Other challenges will be, navigating this field. I think for a long time, even throughout school, and even I think right now the internship schedule has changed after having interacted with my interns recently, because during our time it was hospital, community, and industry. And so it was like we were programmed to think those are the 3 areas that you could work, only for you to come and see, okay, in an industry like Universal where I was at, maybe such a big industry only has 2 pharmacists or 5 at most. Community, of course, there's the challenges that come up with starting a community pharmacy, and then hospitals, maybe they're not recruiting as much as they used to recruit, and it's worse now because they're managed under counties. So it's like, okay, how do you navigate that kind of field now? And I liked what Dr. Daniela said, for us to broaden our minds, even as we're still in school, right now as students, like throw away that box that you've been told, oh, you'll either practice in a hospital or an industry or for a retail pharmacy, because maybe you may never even end up practicing in any of those areas. Yeah, so I will say those are the challenges for now that I've experienced in my journey. Back to you, Sheila.
Thank you, Dr. Patricia. Dr. Daniela, over to you. What challenges have you experienced?
Okay, I'll give not a personal challenge, but a system challenge. As in whatever area you practice in health system strengthening, whether you're doing service delivery, whether you're trying to increase the number of pharmacists in your facility, so you're trying to increase the health workforce, whether you're trying, as Patricia said, trying to get the medicines and health commodities that you need, everything terminates in the money. Who's going to give the money? Who's going to pay for it? Who's going to pay for all these new health workers? Health workers are usually on strike, right? Because the ones in the facilities don't have good working conditions. And then the ones who are trained have not been employed. All those questions, what has been so eye-opening for me is that the financing is so important. So increasing allocation to the health system by many sources, chiefly the government, through the tax system, the employers, the private insurers, the private sector who is building infrastructure. Basically, even people like meds, people like KEMSA who are able to bring to have economies of scale, negotiate good prices because they're buying in bulk, so that the little money we have goes a long way. But I can tell you, even the UHC discussion in the country right now, the crux of the matter is the financing. And so that's a huge challenge in countries of low and middle income bracket where Kenya lies. And health economists are really needed. An understanding of who pays for healthcare is really needed. So many times when we interview doctors and pharmacists where I work, we like to see how broad they think. And so when we ask them, so what are the challenges that you've experienced so far? They tell us, oh, there are no gloves where I used to work. That's why I want to leave. There's no this. We don't have enough workforce. The government should just employ. Then we ask them, how do you think the government can employ? And then the thinking ends there for many people. And so I think we need a lot of minds. I know one of our senior colleagues, our respected seniors, Dr. Professor Kokwaro, has even chaired a national committee on health benefits planning for UHC, meaning if the government allocates a certain amount of money per Kenyan to receive service, what will you get as part of that money? Will you get cervical cancer screening? Will you get your diabetes checked? Will you get free family planning services? What will you be entitled to? So it's a game of mathematics, and we are not taught that in our health training. I want to put this challenge to you all, that if you can increase your knowledge or even study healthcare financing or health economics, health systems need you so badly, because the biggest brains, that's what just a minute. The biggest brains in health systems, what they are cracking their minds about is not about the latest medicines. It's about how do we get more money, and how do we make the money we have cover more people with quality healthcare. Back to you, Sheila.
Thank you, Doc. Thank you for that. The other question is how do we ensure that us as pharmacists, we have a competitive edge over the pharmaceutical technologists, given the fact that they are playing some or most of their roles at the workplace? Yeah, I think I'll let either of you answer that question. So either Dr. Patricia or Daniela.
I think I can start. For me, I will say show your value. If you are at a setting where you are comfortable doing whatever it is that the pharmaceutical technologist is doing and you're okay with that, then you make it hard for, like in future, for the employer to want to get another pharmacist. But if you can clearly show your value, that with the knowledge that I've gotten from school after 5 years of study, this is not only what I can do. I can do this much more, even beyond the setting where you are, because as Daniela said, we are taught to think, because of the nature of our training, it's very holistic. And so if you're able to show your value at your workplace, then, it's no longer a matter of cadres. This is why we have a pharmacist and this is what the pharmacist can do. Otherwise, those cadre wars will never stop. You'll even come to a setting like ours, where when a pharmacist goes for a ward round and you want to give input, if the medical officer is not secure in their role, they'll want to say, but why is the pharmacist telling me this or this? For you, wherever there are medicines within the facility, it's your responsibility, right? And so you give your input and you give it with confidence, knowing, but like while they got, I don't know, maybe just a semester worth of training on medicines, we got 5 years. And so with that, you're able to really show your worth as a pharmacist. Then it's no longer cadre wars, because these things have always been there, will always be there. We can't go down that drain for, pharmacist, farm tech. No, just know where you stand, know the value that you bring, and like step confidently in that space. Yes, I'll hand over to Dr. Daniela.
I couldn't have put it any better. It really comes down to showing your value and, again, thinking out of the box. There are many areas where we're not sharing the practice with them, and those are the typically the non-traditional health system roles. You can really rise in those roles. You have to first be available to learn, volunteer, and if you remain in the same level of competition, then people might take a long time to see the difference between the training. So just show your value. If you're in a clinical setting, show your value. Speak up in the ward round. If you're not in a clinical setting, it's even a lot easier, okay? Because this is now where you really show that you have a systems thinking, you have a sophisticated way of solving problems, and you're not just I will even dare to say this, you're not just thinking about haki yangu me, Daniela, because I did pharmacy, something is owed to me. No, you're seeking to solve problems, and there are not many people solving problems at those higher levels of health system strengthening, where we're talking about healthcare financing, where we're talking about improving access to essential medicines, where we're talking about benefits package. I'll mention our respected senior, Professor Kokwaro, who works at Strathmore. He's a pharmacist by training. He specialized in pharmacokinetics. That was his specialization for years. He lectured in many universities around the world on kinetics. And then he started teaching healthcare management at Strathmore because he realized he just needs to sensitize himself about healthcare management. It's not that all his life he was in management, but because he was a pharmacist and he understood the health system, now he's become such an authority on healthcare management. In fact, he was chairing the health benefits package, even though he's not a health economist. The health benefits package task force of the Ministry of Health that's looking to see what benefits we get in UHC. That's because he stuck his neck out. And at those levels, there's not too many people. So just dare to do it. Believe in yourself because you're intelligent. It's not rocket science. It's really not rocket science to have conversations on those levels. But that's where you distinguish yourself. Back to you, Sheila.
Thank you for that. There are questions that have been posted on the Q&A section. I'll start with the first one. How do you positive yourself with people who can help you in your journey of building your career? I think Dr. Patricia can take this, although I think she had kind of answered it during her presentation.
Come again, Sheila. I don't think I can see the question on my side.
The question is, how do you positive yourself with people who can help you in your journey to build your career? I think how do you, I'm not sure how he wanted to phrase that question.
I think some of these things happen deliberately and some maybe not so deliberately. If you're doing something that you're passionate about, you won't even and that you're shining in, you don't even have to go seeking out for people. They can even come seeking, seeking out for you. And it's I don't know, and you always notice it in any setting, including even in the household. When someone is given a task and they're very good at it and very passionate about it, everyone wants to be associated with that person. It's how people are desperate to get mentors and to be associated with I don't know who and who. And sometimes as much as that is very helpful, on the other side, it's even these people are seeking out for people to mentor, and when you're showing excellence in your mandate, that whatever you're doing it very, very well, it's like these people are even drawn to you even more. So that's why I said it's intentional, but also maybe not so intentional. So the part for being intentional about it, if there's someone who is in a space that you would want to venture into, feel free to follow them, to reach out to them, to ask for you to, to volunteer under them. People are very helpful out here, and they're willing to, to hold your hand, that you can come under their space and learn. So yeah, just and I think it goes back to what you're really passionate about, because if you can identify this and seek out someone who's already doing it and follow them, nowadays it's very open, right? People are very active on social media, they're very active on LinkedIn, on Twitter, and so on, and you follow their journey very closely, that it's not so hard for you to get through to them, to get in touch with them, and to almost get them associated with you. I'll give an example of Daniel. Is he Daniel Waruinge from JQuat? Guy who's doing amazing work in antimicrobial resistance. He started an association called Students. Maybe someone can type it. I don't remember the name, but Students Against Bugs or something like that. So he started doing it, and he reached out to me. Sometime I'd gone back to JQuat to just speak to the students, and he reached out to me and I connected him with a few guys. And now, he's really shining. But it wasn't just, wanting to be associated with me or stuff like that, but he was already working on something. And it was then easy for me to, connect him with people that I knew that were in that space. So I think it's two-way, as much as you are doing it on your side, but also, seek for people to notice you in whatever space that you're in. Seek to stand out. I think that's the word. Seek to stand out. Yes.
To add on to
Thank
that,
you for
yeah, I'd just say hang around in the same vicinity as the people that you look up to and the people you think you have something to learn from. Because many people who would mentor you feel like they don't have time. But if you just hang around them in one way or the other, by volunteering, by being in the same forums, in the same event, networking in an event where they are speaking, then you pick some things. A 5-minute conversation with them can be very useful and point you in the right direction. Sitting down at a conference, and many conferences are even free entry or very cheap to enter, but you've seen the person that you admire is a speaker, just listening to that 1 hour and he doesn't even know you're listening to him, or she doesn't know, you're picking something. You even have something to start a conversation with by talking about the speech that he made. So I think personally, because I know several people ask, can you mentor me? And I honestly, many times I feel I just don't have the time. but the younger pharmacists, the younger health professionals who work around me in my job or in the places where I sit on boards, or when I was at PSK, I was CEO, the ones who came around and said they want to help with producing the conference, they want to help with this and that. The mentorship just happened by default. And similarly, when I look at my own career journey, when I have volunteered to sit on a board, no sitting allowance, no, just giving my time to something that I like, I find on that board or in that forum, they are seniors in the profession or people who are very accomplished. And just by sitting with them in those places, I have picked up, they've mentored me without them knowing. So I think for me, I would lean more towards the non-structured mentoring, just be in the same orbital, the same gravitational space, and something will fall on you. And that's how I've also got mentored.
Thank you for that. The next question is, how can pharmacists improve healthcare systems with regards to key populations such as people living with HIV?
Let me start with that. Key populations have been identified, people living with HIV, and amongst those ones, there's even key populations within the key populations, the MSMs, people who inject drugs. Now, I think the methadone clinics that I know of, it's pharmacists that run them, because when it comes to people who inject drugs, I mean, these are narcotics, and they are specialized medicines that need specialized knowledge, and so that's a real open door for pharmacists to get into. And then in terms of people living with HIV, these are people who are on multiple agents, suffering multiple adverse events from all the agents they're having. And because we're treating HIV so well, people are living longer. So now it's becoming comorbid with non-communicable diseases, cancers, not sarcoma kaposis, which is what we saw in the 90s and early 2000s, just cancers that catch people in their old age. And so the expertise of chronic care management with for people who are on multiple drug agents, it falls right on the lap of pharmacists. Patricia, I don't know whether you have some thoughts, especially working in the hospital space.
Yes, Dr. Daniela. So pharmacists are usually the last point of contact with patients, especially in a setting like mine. Of course, in community pharmacies, then they will be the first point of contact, especially to people, you know our health-seeking behaviors, right? People don't want to go to hospital unless they really want to. And so in a community setup, then the pharmacist is the first point of contact. But in a setting like mine, then a patient goes through the entire, health records, to see the doctor, diagnostics, whether they have any, like dressing or, those services that they need to get, like especially if it's outpatients or even inpatients. But then it comes to the pharmacist, the very last point of contact before the patient goes out into the world, to put it that way. And so we play a very important role, not only to such key populations like HIV, but in essence to everyone else, right? That we, whatever medicines that they're on, just to find out, okay, could the doctor have written a drug that you're allergic to? For example, sulfur. That's a very common one, right? That maybe the doctor wrote something that you're allergic to. Could the doctor, did the doctor tell you, for example, and it happens a lot with patients with comorbidities, that let's say the patient is on hypertension and they're using this, and then they're told, okay, you have to stop that, but then the patient doesn't understand. So you find them taking the drugs that they were told to stop, and even the new ones, right? So crazy incidences of polypharmacy. So you play a very important role in that way, that because they're the last point of contact, then you can reinforce messages about proper medication use. This is what you need to take. This is when you need to take it. This is how you need to, in case of any side effects, this is how you can reach us. This is how to monitor, for example, pressures. If it's below this, if it's above this, you need to seek, such things. Not to take it with alcohol, drug interactions, not to take it with things like even certain foods or even certain juices like grape juice. And so and lastly, just to insist on medication adherence, especially of course to such populations, HIV, TB, even with antibiotics, right? That you have to finish the course of treatment. And so we play a very important role as pharmacists, not only to those very key populations, but entirely to the entire health system. Yes, thank you.
Thank you for that. The next question is, are there any threats as far as our relevance in practice and job opportunities is concerned from the farm techs undertaking HND in clinical pharmacy? I think I'd like to start with you, Dr. Daniela, on this question.
Sheila, I really didn't get the question. Just repeat, please.
Are there any threats as far as our relevance in practice and job opportunities is concerned from the farm techs who are undertaking HND in clinical pharmacy?
I don't know. I'm hearing you saying, are there any any tax? Let me look at the Q&A.
Any threats? Sorry, any threats?
Any threats? Okay.
Yeah.
There are threats as far as our relevance in practicing and job opportunities is concerned from the farm techs undertaking HND. Yeah, for sure, because they're doing what we're asking you all to do, right? Like develop yourself, specialize, increase your skills, make yourself relevant. So any cadre that is developing themselves, then it means they're going to go and present themselves for the same jobs as you. So you, on the other hand, you've got to match up to that and also develop yourself. Forum, I would not want to go into the politics and the issue of regulation and who is supposed to be licensed to and what scope of their practice is. I don't want to get into that. I just want you to think of two pharmacists. Forget that even someone is a farm tech. Two pharmacists, and one specializes in clinical pharmacy and the other one doesn't. So the hospital that is looking for a clinical pharmacist, or even in the interview, they're, let's say they were asking for the same salary, wouldn't you pick the one doing clinical pharmacy? So I'd rather focus on things that I'm in control of. The issue of scope of practice, there's no one person who is on control of it. It's a systemic issue. It's a political issue. It's a difficult issue. I would say I'm a coach and I tell people focus on what you can control and what you can change. Never say that my life did not amount to anything, my career did not amount to anything, because there was another cadre that was rising and obliterated me. That's what I have to say about that.
Thank you for that. Dr. Patricia, do you have anything to add to that?
I don't have much to add, Sheila. As Dr. Daniela was sharing, I just remembered listening to a talk a long while ago, and the speaker was saying how we as Kenyans have almost similar CVs. Everyone got an A, or is it B, and everyone went to the unis, them, right? The unis that we are all in. And so when you're sitting on the other side as a recruiter, and there are thousands of CVs with people who got the same grades and did the same courses and stuff like that, there will always be a threat, right? Even as Dr. Daniela shared, not even across cadres, but even within the cadre, like within the pharmacy cadre, there'll always be competition and stuff like that. But what makes you stand out as an individual? What have you done so that as much as our CVs are all looking the same, that there's something unique about yours, that you have some training here, some experience here, that the recruiter will say, let's pick this one and not this one. So threats will always be there, I think, and it's not only in our cadre, it's everywhere. So even as you're a student now, think about how to make your CV as it is stand out through those little experiences here and there. It'll pay off long time. Yeah.
Thank you for that. The other question is from Derek Okwema. He's asking, what does it take to create a venture investment fund to finance young pharmacists and doctors that want to build their own institution? Dr. Daniela, would you kindly answer this question?
I'm actually looking for it in the Q&A so that what does it take? Let me see. Or to create a venture investment fund. Is that what the question, Sheila?
Yes.
I don't know what it takes to create a venture investment fund. I wish Dr. Machogu was here. I think he's a lot better versed in that. But I do know that there is existing venture capital and looking to invest in healthcare businesses. But you need to first start something to catch their attention, yeah? You cannot just present a plan on paper. And if you have an innovation, the good thing about innovative ideas is that those ones can get funding right from seed funding, from concept. And so if you have something unique that you're doing, maybe in digital health, in telepharmacy, in telemedicine, then there are several innovation hubs and several companies that are happy to put money in almost an unproven concept. I know one of them is called Vilgro. I think they've come to the PSK conference once. Vilgro Africa. It's not that I'm advertising them, but I have seen them around many health fora, and they have supported people from scratch with seed funding. And then and there are several others. So do your homework, reach out to me, reach out to Dr. Machogu, find out who these firms are. And once they give you the first round of funding and your concept works and is profitable, then you can access people who have a bigger wallet, who fund bigger ticket items. There's venture firms that will not fund you if your ask is $100,000. They will only fund you if you ask for $1 million. So and there are people who existing that fund at various levels. So go to those conferences where they are, look for them, talk to people like me or Dr. Machogu who might even introduce you to some of them. But you need to have a concept or something that's already going, and something unique. Because people with money, their problem is what to do with their money. And so you have to convince them that if they put their money in your idea, it's going to grow.
Thank you for that. This one is also directed to you, Dr. Daniela. Which areas do pharmacists work besides community, hospital, and manufacturing?
Wow, that is like a question to me, like, what have I been doing my whole career? Because when I interned in those 3 areas, I realized I can't be around sick patients. I can't inject anyone. I can't inflict pain. I felt trapped in the manufacturing industry. So there are so many areas. Now, I don't know anybody who's on the call who has a PSK card or even a letterhead. Hezron, do you have it where we've listed all those areas of practice where we actually mapped where the members of PSK work? So it was an actual exercise reflecting reality, and we wrote it at the back of all PSK business cards. Does anyone have one? Whether it's you, Patricia, or Anise, or Hezron, and you can take a screenshot and share on the screen.
Yeah, I have it on my end, Doc.
Yeah, is it possible to maybe I don't know how you can do it.
Let me
Show
total
or
share.
even read it out, Hezron. Better still, why don't you read out all those areas of practice where we looked at all our members and wrote where they're practicing in? Kindly just read them out.
Okay, so we have trade, commerce, and enterprise, human resources for pharmacy, medical waste management, post-marketing surveillance, leadership and administration, supply chain, epidemiology, herbal medicine, policy and legal and legislation, clinical pharmacy, community, equipment, Green Cross, e-health, public, health and wellness coach, hospital and specialization, statistics and analytics, sports medicine, academia, drug discovery, clinical research, systems and processes, quality assurance, pharmacoeconomics, nutraceuticals, practice standards, manufacturing, and agrovet.
There you have it. Thank you so much, Hezron. And in the next round of our business cards, we can add management consulting, because that's what I do. I provide strategy advisory for people who are doing the business of health in Africa, whether they're hospitals or pharmacy chains or hospital chains. Anybody who is doing health and is in Africa and is not government, it's private sector, I provide strategy advisory. So that is called management consulting. We can add to that. And I'm sure now, since we did that mapping, if we now look at other pharmacists who've come into the workforce, we'll find even more areas. Anything with a touch of health in it, a pharmacist can do it, I can promise you.
Thank you for that. So the final question is for both of you. The students are asking, do you offer mentorship opportunities to students? And I would want to add on to that and ask, as a mentor, what would you expect from your mentees? So let me start with Patricia this time.
Thanks, Sheila. Whether I offer mentorship opportunities, yes, I do, directly and indirectly. I think the ones that I've worked with very closely, I can mention them. Purity, there's some of you who might know Purity, Daniel, as I mentioned, Daniel Orenge. Those are the ones that I've worked with very closely, and everyone who I've had a chance to work with at my various places of work. But beyond that, indirectly, like just by, like watching my journey and following it closely, it may offer some inspiration to you, especially in regards to volunteering. Because as I said earlier, I wouldn't be here if I hadn't volunteered in the spaces where I have. Let me mention that I'm doing some postgraduate study in health technologies assessment, which is a subspecialization of health economics. And how I got that opportunity is because I had volunteered in the Ministry of Health in the UHC department. So how the opportunity came up is that the Ministry of Health in Kenya and in Thailand are entering into some bilateral agreement. And because everyone in the ministry already had some form of training, then they looked for, we had an intern here, I don't know how many years ago, will she be interested? So they looked for me and I applied, and I was in Thailand for the last 2 years undertaking that training. So really that's a value of mentorship. And that's really how volunteering has helped me in that sense. So yes, I offer mentorship. Feel free to reach me anytime. I think Dr. Sheila will share my contact details. You can send me an email. I'm ready anytime to guide you where I can, and where I cannot, then I'll direct you to the people who can guide you. I think there's a second part to the question, Sheila. I don't remember the second part.
As a mentor, what do you expect from your mentees?
What do I expect? I think diligence. So that it's not waste of time and effort. So just diligence at whatever you decide to like you stick to it until we accomplish whatever it is that we've agreed. And as much as mentorship seems like it's so is it top down, bottom up? It really is two-way. I've had opportunities shared with me from people that I've mentored that I wouldn't have thought of. I have mentees who are even doing better than I am. So for it to be two-way, yes, those will be my, my expectations, because people, like people have access to opportunities all across. It doesn't mean that because I am older in the profession that I know everything. No. And so some kind of two-way interaction, yes. Thanks.
Thank you for that, Dr. Patricia. Dr. Daniela, over to you.
I don't know if you can hear me. I'm seeing that my connection is not that great.
Yes, we can hear you.
You can hear me? Okay.
Yes.
Yes. So what I'll be honest, at this, when I was the CEO of PSK, I had a lot more opportunity to mentor young pharmacists. But now, just because of the nature of my job, I'm not able to give a lot of attention to mentees. Except those who are working with me in my work environment. So if you really want me to mentor, you come and do internship at Africa Health Advisory, and because you will get mentored. However, I'd like to say that even where I don't provide intense direct mentorship, because of my journey, I've come across excellent mentors, and I would know who has more time or less time. And if you tell me your interests, I can tell you, you know what, you need to talk to Dr. Mashogu. You need to look for, Dr. Nyalita, or you need to, and I can make the introduction. And so just, apply for internship if you can. We'll interact there. And if I see your interest, if you're not volunteering, if I see your interest, I'm happy to introduce you to somebody who can hold your hand. And I also encourage people to volunteer at PSK office. Why? Because PSK gives you, and this is not under me, this is under whoever will be working at PSK office. But because PSK is called to the highest levels of decision making in the health sector in Kenya, there's no better training ground, I can tell you that. It gives you a bird's eye view of a health system like nothing else can ever do. So even if it's volunteering to help host a CME, volunteering to help in the conference, volunteering to help in the office, volunteering to call members to pay their membership, whatever it is, it gives you a lot of exposure. Both junior and senior pharmacists walk through that door, and then you have a chance of interacting with the mentors in your area of interest. Back to you, Sheila.
Thank you, Dr. Patricia. Thank you, Dr. Daniela, for coming and making time to come onto the webinar and sharing your insights and your experience and on what us as pharmacists can do to strengthen the health systems around us. It has been wonderful being your moderator. We also have a speed networking event that will be happening on the 25th, which is the day of the World Pharmacist Day. It is a speed networking kind of forum for PSK members. So that is something to look forward to. I would like to open it up to Dr. Daniela and Dr. Patricia to share any closing remarks as we end the session.
Don't stay hidden. Wherever you work, stick your neck out, speak up, contribute your expertise, get noticed, get mentored, and also mentor others. But if you stay hidden, if you keep quiet, if you don't dare stick your neck out in any scenario, if you feel you're underqualified, so you just keep quiet, then you're really doing a disservice to yourself. Because I can tell you from my many years of experience, pharmacists are very uniquely trained to be leaders in the health systems. Patricia.
Thank you, Dr. Daniela. I would say stay curious. There are so many channels for you to, to practice, for you to venture into. In my uni, when I was in Thailand, there was an inscription on the wall at the Faculty of Pharmacy from the founder of that specific faculty that from here you can go anywhere. And really that is true for us as pharmacists. Whether you decide to practice in the clinical field, whether you decide to venture even into beauty and cosmetics, those of you who know Linton's Cosmetics, the founder, I've forgotten her name, but the founder is a pharmacist. The person who founded Coca-Cola was a pharmacist. The person who founded Pepsi was a pharmacist, There's so much for us to do. So really from here, which in essence is your uni, from there where you are, you can go anywhere. So feel free to chart your own path, even where people have not ventured before. Your training provides you such great knowledge for you to really do whatever it is that you want to do. I'm very passionate about purpose because, like work is hard, working every day, with targets and key performance indicators and bosses, it can get really hard, but it helps when you're doing something that you're really passionate about. That it's not just work, but like you enjoy it. You go to work and you look forward to it. You're not, those people who keep wondering, hey, Friday nafika lini, because you're tired, you don't enjoy what you do. So feel free to chart your own path. Feel free to like take time to discover what it is your purpose is, and when you know what it is, then pursue it relentlessly. Thank you, Sheila.
Thank you, Dr. Rees, for the insightful session. We look forward to interacting with the students on Saturday, which is on Saturday on 23rd. They'll be having their World Pharmacy Day activities in the university competitions at Kabarak. So me and a few members from PSK will be joining them, celebrating the day. So I'm looking forward to that. I would like to bid everyone a good night and thank you for everyone who made time to come onto the call and come onto the webinar. I hope you picked up something from the two doctors who've been here with us, and have a good night. Thank you.
Good night.